require any further assistance, please press star zero. I would now like to hand the conference over to your first speaker for today, Mr. Teddy Tishon. Thank you. Please go ahead, sir.
Thank you. Good afternoon. Thanks for joining the call today. Today you'll hear from Minnesota Governor Tim Walz, Assistant Commissioner at the Minnesota Department of Health, Dan Huff, the Mayor of Duluth, Minnesota, Emily Larson, and the Mayor of Brooklyn Park, Mayor Jeff Lundy. Just as a reminder to reporters, if you could limit yourself to one question each so we can get to as many questions as possible, and go ahead and turn yourself on mute if you're not speaking. So with that, I'll turn it over to Minnesota Governor Tim Walz.
Thank you, Teddy, and good afternoon, everyone. Thank you for joining us. It's been a little while since I've joined these 2 o'clocks. If most of your listeners remember back in March when we saw COVID come upon the scene and we started adjusting accordingly, we would give the briefs and certainly bring in the folks from Minnesota Department of Health, folks from Department of Economic Development, Education, and Overtime. And I just wanted to get back on again. Real pleasure to be on with Mayor of 2 of our great cities to talk about the impacts and the partnerships of trying to make sure we keep Minnesotans safe. And we also have learned over 7 months some of the things we can and cannot do that make a difference. And some of those things came out really clear last week. We did a roundtable with from providers to folks who'd lost loved ones to COVID to folks who got COVID. And heard their stories. And as they described, and you've heard it so often, the invisible enemy, I oftentimes think if, like measles or smallpox or something, if there was an outward indicator of people, it might make a difference, because the real fear is folks who have this and are contagious, don't know it, have not yet seen symptoms, and they inadvertently spread it to others. And because this virus affects people so differently, some walk away not knowing they had it. Others, like we heard last week, go into the hospital and wake up 14 days later in a coma. And of course, over 2,100 of our neighbors did not come home from it. So we know that that's really, really important to know who has it, who they've been in contact with, so that they can not only get the help themselves, they can protect their friends, family, coworkers. So what we've really focused on, and Commissioner Malcolm talks about this, is trying to understand where people are getting it from, the community spread. That number's continued to go up. I think it's obvious to most people that the upper Midwest is now a hot spot like we've seen in other parts of the country. The state of Minnesota is surrounded by the first, second, and fourth highest transmission rates in the country. And once that starts to happen, more of the bad outcomes, more of the hospitalizations start to show up just by sheer numbers. So one of the things that we focused on, and the reason for that I want to join this call, and we have the mayors on here as partners, is we want to cut off that community spread by making sure that people get tested as easily and as quickly and as close to their home as they possibly can. The longer it takes for us to find out if somebody has this, the more they unknowingly spread it. So taking a test and waiting several days to get the results, that really impedes our ability to slow this down. So over the 7 months, as we've established a testing protocol, and while Minnesota is testing at a rate as high as any place in the country, the United States was slow in getting testing. I mean, that is an obvious fact, but we've also found that there are different tools that we can use on testing, different ways to go about it. So testing helps us find out who's got it, helps them live carefully, and it protects those close by. Easy access to testing also protects our frontline workers, folks that do have to be out there 24 hours a day. These are our frontline healthcare workers. There are first responders. There are teachers. There are child care providers. All of those folks need to get it. We need to get tested, and they need to get a result. And we saw a story earlier this week talking about if our healthcare workers have to wait, they get sent home while they're waiting for the results, and they don't get paid. And it's becoming an issue. So there's reasons that we've made testing a critical component of our strategy, and I'm really pleased today to announce a significant expansion of that testing. This week, new saliva testing sites are going to open in Moorhead, Winona, and a site in Brooklyn Park will open the following week. Eventually, we'll have 10 such sites. We have one up in in Duluth, and I'll leave that to Mayor Larson to explain what she's seen. And it was from these communities asking us to do that. We'll be launching a pilot program and fully implemented. We'll give anyone a chance to take a test, send in a sample, and get their results without even leaving their house. Hopefully those will be, the goal is to get it as quickly as possible in some cases, and we're exploring every avenue. And I was on today with the CEO of Abbott Laboratories talking about their Binax test, how we can use that. We have 110,000 of them that have been delivered this week to the state of Minnesota. Other laboratories out there looking at some of the things that may be instant testing. And so we'll do all that, and then we'll open another one up in Oakdale. So it's an important step for us. It's truly a product of Minnesotans working together, community leadership, local public health folks, working with the state, with our Minnesota Department of Health, and then also working with businesses to talk about what it's going to take to keep their folks working again. So we also ask Minnesotans to do a lot. And then now more than ever, we've seen it. The biggest thing we can do to ensure our kids have an opportunity to be in school, that our businesses and restaurants remain open, is to simply just follow the science around masking, around social distancing, around staying home when you're sick, around now getting tested, and understanding that this is serious, it is real. To not do these things will guarantee that others will get it. So I'm just asking that we stay with that. And that final piece is that, again, it was hard in the beginning. It was hard to find a test. The swabs went all the way to your brain, it felt like, for many people, and there's a fatigue that went into folks who need to get tested more often. We have come a long ways. We have a lot of different tests from PCRs to these point of origin, where we can start to get folks right when they walk in, get it, make it easy, get a result immediately, get texted on their phone, those types of things. And then I would ask, the one thing that we need is once all this happens is to work together with us, work with the Department of Health, help these contact tracers. This is not about singling anybody out. It's not about anything other than breaking the transmission of this virus. We've seen it. It can work. It's worked in other countries. States are getting this under control, and Minnesota has done a really nice job of staying relatively stable, but it is, again, I have been saying this for a long time. You can go from stable and in a good position to building emergency hospitals on your fairgrounds like they have in Wisconsin or Arizona or New York very, very quickly. So this testing is a big piece of it. I'm going to turn it over to the expert to explain a little bit about what's going on and kind of update where we're at today. And so with that, Minnesota Department of Health Assistant Commissioner Dan Huff.
Well, thank you, Governor. And as you said, part of our strategy to keep schools open, to keep the economy open, centers around testing, around finding out if people are actually infected with the virus or not. So our testing strategy is about providing access for Minnesotans who need COVID testing. Saliva testing is now a part of Minnesota's strategy to expand and diversify the COVID testing options that are available to all Minnesotans. Adding testing capacity allows us to test more of our priority populations, and that includes people who have had close contact with someone who tested positive for COVID, doing more community testing in underserved populations, responding to outbreaks, and preventing growth in cases through this more targeted testing. Minnesota has come a long way in our testing capacity, thanks to our existing relationships with the Mayo Clinic and the University of Minnesota and our wonderful various health systems in the state. Since early September, testing has increased more than 65% in Minnesota. But cases are growing faster than testing is. That is not good. This new saliva program allows us to continue to grow and diversify our testing capacity to meet this demand. So tomorrow, the second semi-permanent testing site opens in Winona at the Winona Mall. It will be open 5 days a week, Wednesday through Sunday. And while it is open to walk-ins, we do encourage you to make an appointment if you're able. That helps prevent crowding and make sure that everyone can move through quickly. On Saturday, we will open our third site in Moorhead, and it is located at the former Thomas Edison High School. It will also be open 5 days a week, but this one is open Friday through Tuesday, and this will be our first site in western Minnesota. And then the next week, on Tuesday the 20th, we will open our first site in the metro area. This will be in Brooklyn Park. The testing site will be in the former Office Max building in the Starlight Center. Now, due to expected demand, this one will be open 7 days a week initially. We will reevaluate hours at each site as others open and the demand waxes and wanes with disease progression in Minnesota. In addition to those that I've mentioned, we are working to finalize details for 6 additional sites later this month. 2 will be in greater Minnesota and 4 more will be in the metro area. We'll share details on those locations as soon as they're available. I also want to mention that each of these sites employ local Minnesotans. About 10 to 20 people will work at each of these sites to supervise the collection of the saliva samples. In fact, in Duluth, many of the people working at that site are actually employees of the Entertainment and Convention Center, the DEC, who have been furloughed or laid off. I will defer more to Mayor Emily Larson from Duluth to say more about the success of that site in just a moment. But let me tell you, we've had, since we've opened September 23rd, we've conducted around 8,000 tests at the DEC. In addition to the semi-permanent testing sites, the saliva program will include a mail order program. The COVID-19 Testing at Home program will allow Minnesotans to register online and receive their at-home testing kit via UPS. We are finalizing some details of the program and expect to launch a pilot in the next few weeks. Those counties that are chosen as part of the pilot will represent a range of geographies and help us ensure that the program will serve Minnesotans in every corner of the state. The program is also being piloted by faculty and staff at the University of Minnesota and the Minnesota State Colleges and Universities. These tests will be processed right here in Minnesota at the new Infinity Biologics COVID Saliva Lab that will be opening in Oakdale, Minnesota this next week. The new lab will reduce shipping time by allowing samples to be couriered from the collection site in the state over to Oakdale instead of having to be shipped to the biologics lab in New Jersey. At full operating capacity, this lab will employ up to 250 Minnesotans. We'll have more details of this opening day soon that we can share, but we are very excited about that milestone. And it is a critical part of being able to continue to expand testing right here in Minnesota. So with that, I am pleased to turn things over to Duluth Mayor Emily Larson to talk more about the success of our first site in Duluth. Mayor Larson.
Thank you. Thank you, Assistant Commissioner Huff. I so appreciate your comments, and I was taking notes while you were talking because I'm, excuse me, very eager to get more information out to our residents about the Oakdale facility and how some of that mail-in testing can be done safely for people. Governor Walz, thank you for inviting me to talk today about what we are seeing in Duluth and for the great leadership and partnership we have gotten from you, the Department of Health. You really heard us when we were talking about how testing and the lack of access to it is frustrating for municipalities. So I do have a few things to say about it. We've been open just around 3 weeks. Our testing site is open 5 days a week, Wednesday, Thursday, Friday. It's open noon until 7. Saturday and Sunday, it's open 10 until 4. And I think I want to start just my few minutes of comments by talking about just a real personal connection to the testing site. My husband wants to go visit his dad, who's in a senior living facility over in Fargo, actually. We haven't seen Jerry since December. We miss him, and my husband needs to get 2 tests before he can go, 2 negative tests. We have had a hard time getting access to tests in other ways. He made an appointment on Friday afternoon. It was about 2:30 or 3 o'clock when he made an appointment to go down on Friday to this testing site. On Sunday morning, he woke up with the result that he was negative. So that's a great sign. Now he's going to go one more time before he goes to see his dad. But it's that kind of access that is game-changing for people to have social connection, for people to move through with confidence. Another story I have, I know someone who went down to get tested just to check it out, just to see what it was about, had no symptoms, was positive. So here's a case where this person was able to go home with their partner, quarantine, and not spread that any further than they already had. So 2 really important ways in which that site is already up and operating that are literally hitting home for me. You know, some of what I'm really excited about for Mayor Lundy and these other sites is that knowledge is power. And we know that every single one of us on this call can talk about that. Part of the big scare for me as a mayor, as a mother, as a daughter, as a wife with COVID is that we don't know enough yet. We're all on the same learning curve. And part of the, pair that with the restrictions that we are doing, that we're placing upon ourselves as good stewards of our community and taking care of each other as Minnesotans who care deeply about one another. The CDC recommendations, the Department of Health, they're really hard. I mean, it is difficult to stay home and it's difficult to wear masks and it's hard to not hug people. I have a kid in high school. That's not easy either. I mean, we are all sacrificing in a big way. And part of the frustration, I think, has been that we're making sacrifices and not even having access to the test to let us know whether we have it or not. So early on in the phase of this disease, when we're all doing the very, very best we can, we have to presume that everyone has it. And that's an important safe starting point. But now we have knowledge and experience here, and it is really game changing. It literally changes how you feel and move through your community when you know that you're taking good care of yourself and you're taking care of people around you, and you can go and get a test. You don't have to have symptoms. You don't have to have pre-existing conditions. It is available for everybody, and that fairness and equity access point is really meaningful and very helpful. The first day we opened up, it was there was just a huge traffic jam. It was chaos. People were eager and excited. The appointments were booked and they take walk-ins. People had to wait. What was exciting about that is that people wanted to know. This is meeting a demand for people to feel healthy and for people to take care of themselves and their loved ones and their families. So we're seeing really tremendous use here. I do think, and I want to thank the DEC, the Duluth Entertainment Convention Center. When we got the phone call from the state of Minnesota several weeks ago that Duluth was being considered for an early site, where would we put it? The deck first came to mind. Everyone knows where it is. There's plenty of space to kind of space out. And space out, safely and have social distance. And the deck was very eager to use their space for the public good. So I thank them for that. St. Louis County is a great health partner. But lastly, I just want to say I think Duluth is an important litmus in the story of COVID and the experience of COVID for the state of Minnesota, because here in Duluth, healthcare is about 24 to 26% of our economy. In many cities, your healthcare sectors may be about 12 or 13%. We're very heavy on that, and we provide the region's healthcare. That means we have a tremendous amount of frontline workers, of essential workers, that is disproportionately large in comparison to other areas. We need these workers to be healthy and safe, and we need people around them to take good care of themselves. This testing site helps us do that. We are a tourism sector that brings, a city of 86,000 people in a non-COVID year has, 6.7 million tourists. And so we are a magnet of activity for people who want to spend time next to this beautiful lake and reconnect with their families or friends. We didn't see, of course, that huge boom in tourism, but we did see mobility. And we did see people come here to just kind of reacquaint themselves with who they are and what matters. And we are a city where that is possible. And so, again, we want to keep frontline workers in our healthcare institutions, in our restaurants, in our 911 healthy. And this testing site helps us do that. So, plenty more I can say, but I'm eager to hear Mayor Lundy speak to what he is expecting in his community. I cannot say enough about what this means for people in Duluth to feel like, wow, I'm making sacrifices, and now I can figure out what my risk level is or how often that happens. And we know of many families and households who are now essentially taking turns with their family members. One person will go each week or something. And that is one really easy way to just gauge where your family is in the course of the pandemic. And then the saliva testing is very easy. It's easy, it's painless, it's quick. You're in, you're out. My husband didn't even spend 10 minutes in the facility. So just want to thank everybody who's working hard and excited for Minnesota. All Minnesotans deserve access like this, and I'm so eager and excited to hear that that is being made more possible now in the coming weeks. Thank you. Oh, and with that, I do want to introduce Mayor Jeff Lundy. He is mayor of Brooklyn Park, and he's going to speak to the Saliva Lab that is coming to his community, and I'm eager to hear from you, Mayor. So with that, Mayor Jeff Lundy.
Thank you, Mayor Larson. So I think first and foremost, I want to thank everybody for their comments. This is a team effort to tackle issues that really cross all communities. I want to thank the governor and his staff for being innovative in trying to take testing, not just saying come into a clinic, but taking it to the people. And I want to thank the Minnesota Department of Health for their help and assistance as we try to navigate this. I will share with everyone that early on, Brooklyn Park made one strategic decision, which is that we were going to share everything that came right from a single source. There was going to be no rumors, there's going to be no speculation, and that we've used the Minnesota Department of Health as our single source of information to share exactly and as quickly as they update, we update our residents, and we made that commitment so that there would be no confusion. And so we know that this testing site is going to be important. Brooklyn Park, we have many communities. Many of our residents were not born in the U.S. About 20% of Brooklyn Park is foreign born. And so for many of these communities, access to transportation, access to healthcare is not assumed, but sometimes it's just not there. And so at Brooklyn Park as a city, working with Congressman Phillips, we actually have used CARES money to invest in a mobile health unit to take healthcare to apartments and different community events, charter schools, so that we can take healthcare to that and remove the transportation barriers from people getting access to that healthcare that they so desperately need. And so we are launching that. We see this program as one of those things. And eventually, God willing, we will have that vaccine that's been fully tested and vetted that all of our residents are going to want to get there and get their shots. And so we see these as kind of a precursor to the ability to deliver vaccine. It's one thing to test, but imagine when everybody wants to get the vaccine. And so, that would be a glorious moment. That'll be a busy moment. And so we know that these sites and these facilities like our mobile health unit are going to help in that regard. One thing I did want to share about the residents of Brooklyn Park and the metro here on the north side is that our residents form the backbone, the invisible backbone of the healthcare system. Many of our Liberians and Nigerians and people from all live in different communities are the home healthcare attendants. They're the people working at hospitals. They're the people who are helping to serve the rest of us. And they do that work day in and day out, 24 hours a day. And so that access to testing is critical so that we don't have people spreading it, so that we are all safe when we're all being tested. And I think another aspect that's really, really important, people tend to overlook, is these different communities. I first and foremost know personally is they have their own charter schools, their own community stores, their own churches. And so what happens if you have people who are not diagnosed with COVID, you can get a spreader that really can hit one cultural group hard because they are so intertwined with each other. And so many of the things that they do, they share with each other. And so unfortunately, sharing COVID is not a good thing. We want to share faith. We want to share stories and experiences in life, but not the COVID. And so having this access to testing will help us identify those people so that they can help protect their loved ones. And so our communities are very tight-knit. They work together, but if people aren't being tested, it's very hard for this. And so one thing I would share, and the last thing is just, we are excited for this. When I talk to residents, I talk to business owners, I talk to people who've lost their jobs and people who need their work. Is not one person has ever asked me for a Democratic solution or Republican solution. What they've asked for is a Minnesota solution to this. And that I think this is delivering that. People just want to be safe. They just want to survive this. And hopefully they want things at some point to get back to normal. And we know that with good testing, access to transportation and healthcare, that we can get through this faster, stronger, and look for a time when we all used to get together in person to do these things rather than doing those dang Zoom calls and everything else that we do to try to keep ourselves. So with that, I would like to turn it back to the governor with my thanks on behalf of Brooklyn Park and to your work and to your staff for bringing the solution to our area.
Well, thank you, Mayor Lundy and Mayor Larson. If you want to know the pulse of a community in Minnesota, ask a mayor. You can feel the sense of pride. You can feel the sense of responsibility. More importantly, with a mayor, they don't really have time to posture and debate things. They simply have to deliver. So you can't find a better partner. We're certainly grateful for that. We want to make sure that we're doing our part to get those resources out into the community. And for all the reasons these mayors talked about, this is the way we manage and we try to attempt to live with COVID the best we can. And Mayor Lundy brought up a great point. The lessons that we've learned will spill over, and we are preparing extensively and being asked nationally to provide some of that guidance on what it'll look like when we do a massive vaccine program. And again, we're hopeful for that. We know it's one piece of it. In the meantime, the masking up, the social distancing, the washing your hands, and then your testing when you need to be tested, and listening to all the creative ways people are using this. So with that, operator, I would ask you to turn it over, and we'll take questions from the media that's here.
Thank you so much. Again, as a reminder, to ask a question, you will need to press star, then the number 1 on your telephone keypad. Again, to ask a question, you will need to press star, then the number 1 on your telephone keypad. Our first question will come from the line of Emily Havoc from CARE 11. The line is now open.
Hi, thank you for taking my question, and thanks to you all for speaking to us. Governor Walz, this would be a question for you. As we just saw Wisconsin dial back and reinstitute some more serious restrictions given the COVID rise, are you considering something like this for Minnesota? And if we do dial back, what will that look like? What can we expect?
Yeah, well, thank you for the question, Emily. And we always look at the numbers. As we said from the beginning, the data and the facts will drive us to where we're going. We are certainly in a better place than our surrounding neighbors, but that can change very, very quickly. And I think one of the things is to understand where the spread is coming from, because I think one of the frustrations people feel like is that if these restrictions are across all sectors and you're not seeing the spread, say, come from churches or come from, whatever it might be, a small retail shop, we need to be specific. And I think what we would say is I would not feel comfortable giving any specifics, but we would look at the individual situation. We would use the data from MDH. We'd work with our partners. And one of the things I think that should be highlighted in this is groups, whether they be nonprofits, for example, schools, public schools, or whether they be for-profit bars and restaurants. These trade groups and these organizations are working hand in hand with us to try and craft ways that we can get this right. So I think it would be dependent on where the spread is coming from. One of the things we've continued to say, and I know Commissioner Malcolm and Assistant Commissioner Huff would certainly echo this, is that we're seeing it in a lot of different places, but some of these gatherings like weddings, funerals, those types of things. And I know how hard this is. I just want to speak to Minnesotans again. This is the worst to the things that it's stopping us from doing. And I know this is small on the list of things, but for my family, my 14-year-old son, Gus, he's celebrating his 14th birthday today, and it will be his mom and I and him, not his friends, which he wants there, because we can't do it. So it will be dependent on where the spread's coming from. It will be dependent on how fast that spread is going, and then we will use the best data we have. But at this point, one of my goals is to be thoughtful and turn those dials moderately, to continue to ask Minnesotans to help keep these businesses open by masking, social distancing, testing when you need to. And at this point in time, we'll still continue to watch that.
Thanks, Governor. And technically, I believe we still are in phase 3 of the Stay Safe plan, and there's sort of a model laid out on the state's website. Could you see us going back to phase 2? Or what I'm hearing you say is that it would probably be a much more targeted approach than fully transition to a different stage that you have listed somewhere in a map.
Yeah, no, it's a great question, Emily. And one thing I've learned over the 7 months is don't step into the space of Minnesota Department of Health where they have it. But I do think, Jan, if you wanted to add anything, I would say I think one of the things we've learned over the 7 months is to be more granular, to use the scalpel when we can rather than a bigger approach to it. But sometimes with the pandemic, that bigger approach is what's needed. Jan, is there anything to add to that instead of turning massively, we're kind of looking almost at individual industry to industry and event to event?
Hi, this is Commissioner Malcolm. Thanks, Governor. I think you got it exactly right. I think we've always been trying to be as targeted and specific as possible and as balanced, but I appreciate that the Governor keeps reminding us that all the tools have to be considered, and that when we get to these very high levels of case growth and community spread, that's when it becomes more challenging to do the really surgical approaches that the Governor would prefer. And we just keep reinforcing how very much power actually we as individual citizens and communities have over this, that our behaviors matter hugely, and we can make a choice to do the things that we know work to slow and stop the spread. And if we do that, we'll have a much better chance of keeping our businesses open and our kids in school.
Thanks to you both. Appreciate it.
Thank you. Our next question will come from the line of Jeremy Olson from Star Tribune. The line is now open.
Yes, either Governor or Assistant Commissioner Huff. I wanted to ask the contrarian question of, can there be too much testing under this expansion? Are we going to inflate the numbers with mild or asymptomatic cases that could result in overly aggressive closures or restrictions on schools and businesses?
I'm going to leave that one, Jeremy, to the experts to explain why I don't believe you can overtest. Go ahead.
Thank you, Governor. Jeremy, we have to think back, what's the purpose of testing? So the purpose is if someone is infected, allow them to know that they're infected so that they can isolate, and then that we can follow up with anyone they've been in contact with so those folks can quarantine. That's how we stop transmission of the virus. So given that premise, we really can't overtest. If someone is asymptomatic, they can still spread the disease, and we want them to get tested so that they can learn, oh, I do have it, I need to stay home, and in my interview with public health can then contact whoever I might have been in contact with. That's how we slow transmission of the disease. And I will add that even as we have dramatically increased our testing, our positivity actually has not dropped. That means that we're finding more and more people who are infected with the virus, and those people can now stay home and end that transmission cycle.
Is there any need to kind of rebalance some of the statistical indicators like the county levels on which school recommendations are being made? Because more testing will find more cases, and as you said, there's all kinds of positives from that, but it will result in a more negative outlook potentially for some county rates and some school decision making.
Jan, I'll let you
Sure.
or Dan follow that up. If I could, for just make the case on that, one of the things that we're doing is using those county positivity data, but looking kind of holistically at this, looking at the physical infrastructure of a school, looking at their capacity to be able to distance learn or whatever it may be, or impediments to it. So I do think the question is good, and I think hearing health answer this, one of the things I think it's healthy for us to continue adjust some of these goals, but not to lose sight of some of these are basic epidemiology that once you hit a certain goal, this becomes a math problem. And the spread of a virus will grow exponentially based on that. So some of these, like the 5% positivity rates, there's a good reason that's in the textbooks about why you should be careful, because that's where you start to get spread. So I would just note that we combine a lot of different things, but I hear this theory out there, and it's unfortunate we become somewhat politicized. I would have never believed I would see elected leaders telling people not to go get tested no matter what, because they believe we were just going to use it to close their schools, which is absolute insanity. It's not grounded in proof, and it actually makes it harder to open the schools. So I hope we can, continue to communicate. But your question about readjusting as we move through this, I think it's always good to keep some of those things open as we've learned more. And we're trying to do that, whether it be adjusting seating capacity in a restaurant while still not tipping us over to the point where infections increase. Those numbers can change. And if we think because of our tools and people's adherence to these basic health principles like masking, that we can make those changes and still operate. So Dan, I don't know if you want to add anything to that.
No, Governor, I think you hit it. It's important to remember that these are the targets that we have and the plans we have in place are to protect people. And if someone is infected and they don't know it, they can spread the disease to someone who can suffer life-threatening complications. So the goal here is to protect life, and it's to protect health of all Minnesotans. And that's something I think we need to keep our focus on. Testing allows us to do that, so that if I am infected, I need to know that so I can protect others who might be more vulnerable.
Thank you.
All right. Our next question will come from the line of Matt Sepik from Minnesota Public Radio News. The line is now open.
Hi there. This is for the health department, folks. How many tests could Minnesota potentially conduct each day with the addition of the saliva test once everything is up and fully running and up to speed?
Dan, I'll let you take that if you have that data.
Sure,
I think it's
Commissioner,
north of
thank you.
60,000. Yeah.
Yes. So the new saliva lab running full shifts can process 30,000 tests a day. We are currently just north of 30,000 tests on our biggest day without the saliva lab. So we'll be at over 60,000 tests per day capacity when that lab comes fully online. Thank you.
And in terms of the collection, is that infrastructure in place? Even if we can process 60,000 tests a day, will we be able to collect all those samples and get them to the lab quickly?
Yes. Well, that's what while we're rolling out these various methods. So we have our semi-permanent sites that we're announcing the rollout of additional sites today, in addition to the one in Duluth, but then also this pilot mail order program. We already have K-12 faculty and staff are able to do mail order saliva. Now, University of Minnesota and MNSCU faculty and staff are able to do mail order saliva, and we're operating this in some counties around the state as a pilot with the goal that every Minnesotan will be able to access these through mail order, where the UPS will deliver the kit, you fill it up, and then ship it back to UPS to Oakdale. So that's this two-pronged strategy of having the collection and then having the lab capacity to process the tests once they're collected.
And just one real quick final follow-up. Will contact tracing be as necessary now that we'll have so much testing capacity, or will contact tracers still have to be making all those phone calls?
Oh, absolutely. You know, that's the cornerstone of the public health strategy. If someone is infected, their local public health or the state public health department will call them, make sure they have what they need and they have the information they need, and then to find out who they have been with, so that we can then call those contacts. And remember, it's always anonymous. We never tell a contact who was the infected person they might have been exposed to. The confidentiality is very important. But then we want those contacts to quarantine. That's how we end the cycle of transmission. So yes, that contact tracing will still be a key strategy.
All right, thanks.
Our next question will come from the line of Theo Keith from Fox 9. The line is now open.
Hi there. Some specific questions for the health officials on the Oakdale facility. What's the address for the facility? What's the cost of the facility? I believe, Commissioner Malcolm, you were quoted in August as saying it was going to be $5 million. And then thirdly, most importantly, you were also quoted at the same time as saying that the facility would be operational in October. Probably the most important thing people will be wondering now is when are they actually going to be able to order one of these at-home tests, send it back, and it'll be processed? What'll be the first day it's up and running in that way?
This is Commissioner Malcolm. I'll ask Dan to try to answer a couple of your specifics there, but just to clarify on that last point, the mail order program is something that we're just going to be pilot testing now. So the opening of the lab and the ramp up of a mail order program are two different things. So the day that the lab opens, which we believe will be in the next week or so, Dan, maybe, I don't know if you've got a specific date yet, the mail order program won't be fully in place on that date. So just to clarify that point.
And this is Dan, and I do not have the address or the budget in my head right now, but we can definitely follow up with you and get you those numbers.
And we'll be making further announcements about the opening of the lab as soon as we have the specific details for you.
Okay, so if I may follow up, what's your best guess on when the ramping up of the mail program will happen? When will somebody be able to request something, get it in the mail, send it to Oakdale, and get it processed?
Well, so that the Go ahead, Commissioner. I'm sorry.
No, you go ahead, please.
So with any large program like this, we run a pilot first. There's always going to be some kinks to work out. By running a pilot, it allows us to make sure that we streamline and smooth out the system so that everything runs smoothly. We are hoping to start that pilot next week. We have already been working with our K-12 teachers and staff, and the University of Minnesota and MNSCU already have begun to use that system as well. So it's in flight. The pilot is in flight, and we're hoping, I can't give you a specific date because we have to make sure we work out all the issues that we may come across. If there's no or a few issues, it'll happen really fast. If we find things we have to work through, then we'll get through those. What's important is not only that we do it quickly, but that we do it well. And that's what we're doing. We're making sure that anything we implement, we've thought through and worked out any issues.
Would this be a 2020 thing or a 2021 thing?
Oh, it'll be 2020. We're thinking November.
Okay, that helps. Thank you.
Our next question will come from the line of Tom Hauser from KSTP TV. The line is now open.
Hello, Governor. Question for you about a statement. Apparently, it's not the official stance of the World Health Organization, but it is one of their primary emergency people dealing with COVID-19, Dr. David Nabarro. He was quoted in USA Today and elsewhere in the last couple of days that using the lockdowns as your primary control method for blunting a virus surge is not recommended. He said, quote, "We in the World Health Organization do not advocate lockdowns as the primary means of control of this virus. They should just be used to buy time, as you did back in the spring." What is your reaction to that? It's been getting a lot of reaction around the world.
Yeah, I did see that. Yeah, I think they're right about that. I said early in March, and I think even Dr. Ostrom and others, that it's not sustainable to keep people locked down. That original lockdown was to slow, get us some capacity, and then I think you have to figure out how to continue tweaking along this. And there isn't a clear-cut example. There is no federal strategy. So, I understood that the optics this week of states around us reaching critical mass going up, our numbers are kind of holding on the edge, as Jan often says, and yet we did make some adjustments because it's the only way to keep it going. So I think a full lockdown, we missed that opportunity, and I kind of feel like that boat sailed when the entire nation didn't just do it. But I do think there may be times, which you're seeing, depending how bad it gets, you're seeing, in Great Britain, Spain, and others, starting to look at localities doing a little bit more of that. But no, I just don't think it's sustainable. I don't think you can continue, over the long haul. And I think here, that's what you have to be careful. I was just noticing of the upper Midwestern states, Indiana a couple weeks ago went to fully open, and I was speaking with some of the folks from Indiana yesterday, and they'll be turning back their dial because of that. And I think you have to keep adjusting that. I don't believe that should be your fallback position, and I don't think they are sustainable.
And Governor, a quick follow-up that is off topic, admittedly, but if you could just give me 30 seconds on this because it's our only chance to talk to you today.
Sure.
The report from Senate Republicans about the riots in Minneapolis, they claim that you and Mayor Frey failed to realize the seriousness of the riots and the danger to Minnesotans. I don't know if you've had a chance to review that report or look at it. Democrats are criticizing them for only giving it to them an hour before it was released. But do you have a reaction to that?
Well, I certainly wish that I could find some partners. I've been asking them help us out on things like State Patrol Training Academy, some of the funding mechanisms we have. I know that they've highlighted the need to not talk about COVID, talk about public safety, but what happened at the end of May and the death of George Floyd and what happened, that is public safety, and we need to learn from that and continue to do better. But so is COVID-19 and the number of people we had killed in that. So I know that it's getting close to an election. They need to do that. I would just ask them, work with us on this. We all agree on this for public safety. And I think the mayor, and I certainly believe our administration, whether it be the National Guard, the State Patrol, the DNR, our frontline folks responded in a noble and heroic manner. They saved life. And we should continue. I'm more than open. Work with us on this. If there's lessons learned, we certainly want them. I've continued to say one of the lessons I learned was we have to communicate way in advance, years in advance with our partners in cities and counties to understand what the capacity the state has, what they have, and how we partner together on that. So, a one-sided report coming out right before an election isn't as helpful, but if there's helpful advice in there, I'll certainly take it.
Okay, thank you, Governor.
Our next question will come from the line of Steve Karnowski from Associated Press. The line is now open.
Yeah, hi. Thanks for taking my question here. Just back on the subject of the mail-in testing, forgive me if I missed this, but what's the cost for that and who's going to be paying that? Is it health insurers? Is it the state or is it the individuals?
Yeah, I can take that.
Yeah.
Sure. So the final cost, I don't think we've announced yet as far as our contract. It'll be less than what is advertised on their website just because we are doing a state contract with them. Your insurance will be billed if you have insurance. We do ask for your insurance card so that we can bill your insurance. However, no bill will go to you as a Minnesota resident. We are committed to making sure that every resident of Minnesota has the access they need to testing. So we will bill insurance. However, if you are uninsured or underinsured, you will not receive a bill.
Our next question will come from the line of Kelly Boucher from Duluth News Tribune. The line is now open.
Hi, this question is for the Department of Health. I'm curious, have there been any new cases linked to Trump's rally in Duluth since yesterday's reported 3 cases?
This is Commissioner Malcolm. We don't have Director Erzman on the line with us today. Dan, I don't know if you have any updated data at your disposal, but we can certainly follow up with you offline on that.
Commissioner, I do not.
Okay.
I do not either.
Okay, I'll follow up with you all after this call then. My next question here then is about contact tracers. Do you have any sense how truthful people are being when speaking with contact tracers?
Commissioner Malcolm, it's an important question. I think certainly it's part of why we want to do a good job of explaining to people what this process is, why it's important, how the information is used, because all of this turns on voluntary compliance from folks being willing not only to literally to answer the phone when we call, but how forthcoming they are with the information, how forthcoming they are with the details of where they've been. We do, I think what we hear when we talk to the folks who are doing these case investigations and these calls is kind of a mix of responses. I mean, for the most part, and we do keep statistics on the percentage of people who with whom we are able to speak versus those who refuse to talk to us. And luckily, happily, that's a small percentage of cases, but the quality of the information really does depend upon people's participation and how forthcoming they are.
Thank you. Our next question will come from the line of Courtney Godfrey from Fox 9. The line is now open.
Well, I think everybody has asked some great questions. One left here. it speaks to the accuracy of the saliva tests. I know yesterday it was addressed how these rapid tests are really only effective if you're within this specific window of symptoms. How accurate are these saliva tests? Because if you're not symptomatic and you test on the rapid test, you can get a positive when you truly aren't positive. And we heard Mayor Larson share a story about somebody testing positive when they weren't symptomatic. So how accurate are these saliva tests? Are they as good as the full-blown test?
I think the answer to that is that this particular saliva test that was the first given an emergency use authorization by the FDA has a very high rating in terms of the specificity of the test and the sensitivity. Dan, you may have precise figures, but it's very, very close to the nasal swab. This too is a PCR test, so the saliva test is measuring the same thing as the nasal swab test, just a different collection method, and the results, from what I understand, are quite comparable. Dan, do you have any specifics?
Commissioner, I don't have the specifics, but it is within a couple of percentage points of the nasal pharyngeal swab, which is considered the gold standard. But as the commissioner mentioned, this is a PCR molecular test. So it is the gold standard laboratory testing. It's just a different sample collection technique.
And with that, folks, this is Teddy chiming back in here. Governor, we're coming up on the hour, and I think we might lose our call here at 3 o'clock Central. So any quick last thoughts from you before the call cuts out?
Well, thank you to the mayors. Thank you, Department of Health, all of our partners. Thank you to the media for getting out good information and really important questions. We're 7 months into this. I can still remember the day when we said we were going to up testing in Minnesota when it became apparent that there wasn't going to be federal testing. And I remember when 5,000 tests a day would seem like a high bar to try and reach. So COVID's taken a lot from us, but we've learned a lot. We've worked together. I think this newest announcement and the rollout over the next several weeks should put us in a better position. But as I said back in March, this is a long haul. It's going to be a long winter. We're still in that winter. My public service message today is mask up, social distance, get tested if you need it, and go get a flu shot. All those things right now will help relieve pressure on the hospitals, keep folks safe. So I want to thank you all for joining us, and we'll talk to you again soon.
Thank you, everybody. Operator, that concludes today's call.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.
This has been a WDIO News Special Report.